Galvez and other task force officials met with the president last night. Let's get more details from our Trisha Terada. Trisha, good morning. So do we know when will the vaccines arrive?
Yes, Ria, good morning. Well, if we were to base it on the report of the vaccine czar Carlito Galvez to President Duterte last night, he says vaccines will most likely arrive within the week. He adds a military aircraft will be used to transport the vaccines from Sinovac. Galvez assures the rollout plan is ready. The vaccines are also guarantees that Sinovac doses are safe. He says it's been rolled out in other countries like Turkey and Indonesia, where healthcare workers aged 18 to 59 years old have been prioritized. The government has yet again defended Sinovac's low efficacy rate among health workers in Brazil. Galvez tries to explain that this strain in Brazil is different and it's more transmissible due to high number of infections. Health Secretary Francisco Duque weighs in also on Sinovac's efficacy.
Moderna, AstraZeneca, and Sinovac, based on their clinical trial data, 100% ng efficacy rate nila in preventing severe COVID infection. Eh yun naman sir ang importante kasi yung namamatay galing dun sa severe. So if you're able to prevent severe infection, walang mamamatay. And Sinovac belongs to that group that offers or provides 100% efficacy or effectiveness, sir. So, I am not surprised that some countries, despite the the indications in the issued emergency use authorization, they opted to still include their healthcare workers within the age group of 18 to 59 years of age.
The vaccines are, along with some officials and Manila Mayor Isko Moreno, volunteered to take the first shot to build confidence among the public. Back to you.
So, Trisha, I want to go back to that statement of Secretary Duque. Is this now an indication that health workers will be included in the list of priority recipients for Sinovac?
Well, Duque says there may be changes on the indications for the use of Sinovac vaccines, but nothing is final yet. He says they are awaiting feedback from a group of experts through the National Immunization Technical Advisory Group, or NITAG. Ria?
Okay, Trisha, how are we in terms of the COVID situation in the absence of a vaccine?
Well, in general, Duque says the number of infections in the country has plateaued despite a slight increase after the holiday season. The spike slowed down end or mid-February. However, zooming into the data, DOH notes an increase in the 2-week growth rate in Metro Manila, Region 4B, Region 7, and 10. The Cordillera Administrative Region, Region 7, Caraga, and National Capital Region reported a higher daily attack rate at 1.56 per 100,000 population. CAR has the highest average daily attack rate at 5.6 confirmed cases for every 100,000 people. DOH urges Region 7 to intensify their anti-COVID strategy, especially in high-risk areas like Cebu City, Mandaue City, and Lapu-Lapu City. Region 7's healthcare utilization rate remains at safe levels, but Lapu-Lapu City is still at moderate risk. Focus areas in Region 10, meanwhile, include Cagayan, De Oro, Misamis Oriental, and Bukidnon. These have been placed under moderate risk classification. In Metro Manila, Navotas and Pasay City have been tagged under high-risk classification.
All right. We seem to be having a problem with the line there with Trisha Terada. We'll try to stabilize that line so we can get more information about the briefing last night. So just to recap, we had a soundbite there from Secretary Duque saying that as far as the Sinovac vaccines are concerned, they are 100% effective in preventing severe COVID-19. All right, I believe we do have Trisha back on the line. Trisha?
Yes, Ria. As I was saying earlier, last week, Malabon, San Juan, Makati, Las Piñas, Manila, Valenzuela, Quezon City, and Pateros were classified under moderate risk. But overall, NCR is under safe zone in terms of healthcare utilization rate, except for Makati, which is on moderate risk or 63% utilization. Back to you.
Okay, Trisha, we don't have the vaccines yet. We're not entirely sure when they're coming. A massive rollout might not happen until the second half of the year. What is the president's new directive to local government leaders in that light?
President Duterte now requires local governments to buy masks and give it to their residents for free. The president notes difficulties in securing vaccines as rich countries hoard about 75 to 80% of the supply. So in the meantime, he understands masks to prevent more infections. In the same breath, he also defends himself for failing to follow his own directive to wear masks at all times.
Very careful. Ako naman, I've been criticized. Tama kayo. Na ito si Duterte nagsasalita, hindi naman sinusunod. Tama kayo. Na hindi naman nagmamask. Tama kayo. Hindi ako hold upper na sanay magsalita nitong kaya tinatanggal ko. Now, I run the risk of baka ako dali rin. May vice president man. Siya na ang susunod.
The chief executive reminds everyone to continue following the minimum health protocol. Back to you, Ria.
Thanks a lot for that. Trisha Terada there reporting.